And to get us started, again, we have our wonderful presenter, Jim Sullivan from payingforalzheimers.org, a non for profit agency. And his program, Fulfilling the Promise, expanding financial assistance for Medicare prescription drug coverage, will cover exciting changes that will benefit low income Medicare beneficiaries in 2025. With the annual enrollment period beginning on October 15th and still going, these changes will impact the choices available to your clients. For those that weren't able to see Jim last time, just to give you a little background information, Jim's a volunteer community educator for the Alzheimer's Association and has been designated an Alzheimer's Association National Community Leader. He spent over 20 years as a financial advisor working with individuals diagnosed with a chronic or terminal illness and their families. He's written over 100 articles for the Association of International Certified Professional Accountants on the impact of chronic and terminal illness on household budgets. He is also the author of the AICP book, Retirement Healthcare Planning Guide, currently in its 6th edition, and a new publication, Health Transitions Guide, written for CPA planners assisting clients undergoing significant changes in their health and how it impacts their financial planning. I will share Jim's contact information. He gave me his email address and his phone number, and I will put that in the chat. And that's also a reminder for those that have just joined us, please feel free to put your name, where you're from, and your email address. Thank you to those that have done that already. But without further ado, I am going to hand this on over to Jim. Thank you for being here, everyone, and take it away, Jim.
Thank you, Renee. Let me just expand on your comment about kindness. I was telling Renee prior to opening, prior to the time when she opened up for the webinar, in my prior practice as a financial planner, I did work with individuals who had been diagnosed with chronic or terminal illnesses in their family and what the special planning requirements were when you're faced with that situation. And I was telling Renee, one woman I worked with, this was probably about 3 or 4 years ago, Anne was diagnosed with ALS or Lou Gehrig's disease, which is a horrific disease if you're familiar with it. And so I would meet with she and her husband. They had 3 kids, 1 heading to college and 2 still in high school. She's only 50 years old. Her particular brand of ALS was very aggressive. And so we met frequently to talk about their finances and issues related to her health care. In this case, her employer plan continued. And during our last meeting, her husband had left the room to go get some glass of water. And she looked at me and she said, "Jim, I'm worried about you. Are you okay?" And I said, I'm doing fine. Thank you. I said, "Why are you worried?" She said, "Well, I know these meetings with me are hard on you because of the progression of the disease. And I just wanted to make sure you're doing okay." And I thought, here I'm meeting with a client who is near death, has this horrific disease, and she thought enough to offer that kind word to me. And I always thought about what my dad would tell me when you get a compliment and sometimes you don't properly thank for it. He said, think of it as a gift from somebody. Don't denigrate it. Don't try to say, no, I really don't deserve it. Just thank them because that's their gift. And to the extent you try to minimize it, you're really hurting the value of their gift. So learn how to take a compliment as just as importantly, how to give a compliment or a kind word. But I always think of Anne when I think of kindness and thoughtfulness. She died in December, about 3 years ago. But I always remember her. She had a wonderful laugh, great sense of humor. And I always thought, I hope I can handle, when I'm near the end, the same grace and courage and faith that she exhibited during her last few months. But that to me is true kindness. So let's talk about what we're going to cover today. Is the screen showing? Okay.
It is, yep.
I think we're living in an exciting time as far as the Medicare and low income families. I happen to work and pay particular attention to Alzheimer's disease just because of my family history. I think I mentioned this last time. I had an older brother who died of Alzheimer's about a year and a month ago. And I had an older sister who died in 2021, actually just about 2 years ago now, of a dementia, not of the Alzheimer's type. But I had thought that we were fortunate in that their families could afford the cost of care that they had to deal with. That Alzheimer's, any dementia, is very expensive. Not much is covered by Medicare, and you have heavy care expenses going to nursing home. And what inspired me to start paying for Alzheimer's is that I wanted to be able to reach out to lower income families who are dealing with these issues, because they're the ones who need particular help in terms of, what do I do? I'm already having trouble making ends meet, and now I'm caring for my sibling, for my mom or dad or my grandma, and all these costs are being imposed. What can I do? And that's what paying for Alzheimer's is designed to do, to work with those families. And for most families, we take people regardless of their ability to pay. We have scholarships for people who are can't afford the fees, and we've never turned anyone away because of fees. So we are not for profit. And one of the things I'm excited about now is that we've seen Medicare Part D, and this is why I call it fulfilling the promise. When first it came out, Medicare Part D was just a discount card. I remember going to assisted living facilities and nursing homes and talking to the residents about Medicare Part D. It started as just a discount plan. It really wasn't insurance, but within a year or two, it started to be a true insurance program, which until then, Medicare had very little coverage for prescription drug, believe it or not. Part of it was that, as a CPA, it's a cost benefit analysis. If I can give you a drug that helps with your disease, keeps you out of the hospital, makes you feel better, and is lower cost than going to a hospital or a nursing facility, why wouldn't Medicare offer that as part of their package of benefits? And that's where it started. So about 2006 or 7, and then it became a true insurance program, but there were still big gaps in it that were very expensive for, particularly for low income families, that you could get the Medicare prescription drug plan, but there were things like, you probably heard of the donut hole and catastrophic coverage, where if you had very expensive drugs, you could still end up paying quite a bit. And let me give you an example. I had a client who was a retired minister. His wife was a retired school teacher. And near the end of his life, he had heart disease, but he also developed a cancer. The cancer drug that his doctors recommended at the University of Chicago cost $15,000 a month. Now, the Medicare Part D said you will pay the greater of $10 a month for the brand drug, which this was, or 5% of its cost. Well, 5% of $15,000 is $750, which on a retired minister and a retired teacher's pension is not affordable. So we started calling, and we got some financial help for him from the drug company. But that's what people were faced with. And very few people know about it because very few people got into that catastrophic coverage. Well, fortunately, that's gone now. Now, if you get into that situation, once you get beyond a certain amount of drug costs for the year, 100% is now paid for by Medicare. So you don't have to worry about co-payments or co-insurance once you get beyond a certain amount. So there are changes that occurred not only in 2000, that will occur in 2025, which we'll talk about, but in 2024 and 2023. A lot of you, if you know people with diabetes, in 2023, there was a cap placed on the amount that the plans could charge for insulin. And so that was very helpful. In 2025, we're going to cover some of the upcoming changes. In 2024, one of the things we're going to see the moderation of the catastrophic drug costs that people face. We'll talk about that. And that is, to me, what the promise that's being fulfilled. I think Medicare prescription drug plans are becoming more robust. They're becoming providing more benefits to people in lower income. But the key is the people in the lower income have got to understand that these programs of financial assistance are out there. And the statistics I've seen are anywhere from 40 to 50% of those people who are eligible for these financial assistance programs aren't even aware that they exist. And that's another goal that we have at Paying for Alzheimer's, of educating both people like you who serve that community, people who are in the lower income, and even people, frankly, who are middle income. I call them the forgotten middle class that deal with these costs. And they're in many cases, particularly with Alzheimer's or ALS, they're hard to deal with unless you're very wealthy. So we have as our goal to educate people who are in lower income or middle income about these changes. And that's what we're going to talk about really briefly today. And that's what the promise that I think is finally being fulfilled. We're going to talk about Leqembi. That is a new drug that was approved by the FDA in July. Once it was approved by the FDA, Medicare agreed to cover it. We'll talk about what Leqembi is and how that may be viable for some of your clients who are in the early stages of dementia. And we're going to also talk briefly about the new guide program announced by the Centers for Medicare and Medicaid Services, CMS, that is to me representative of a shift that I'm seeing in Medicare, where they're providing more and more assistance to families where they have a homebound patient. They're taking care of the patient at home, their family member, but that doesn't mean they aren't incurring expenses. So the guide program is really meant to create a support structure around home care. And I think we'll see more of that as we go forward. The guide program, actually, there was just a webinar I attended just in October, and they're already underway with programs to test to provide support. So we'll talk about that briefly, but that to me is an exciting development as more support is being provided to people who are providing home care. Now, why is this discussion important to Medicare beneficiaries? I've talked already about recent legislation has increased financial assistance for lower income beneficiaries. And if you deal with those families every day, it's so important that they understand what's available and how to get through and jump through the hoops to get the benefits of those programs. I already talked about the forgotten middle, that people in the middle and lower middle classes will also benefit. So it's a time where I think we're going to see finally Medicare confront the issues of Alzheimer's and other chronic and terminal illness and the needs of families who are providing home care. Why is this important to you? Well, you will have clients who may have Medicare questions in need of guidance, especially this time of year. From October 15th to December 7th, Medicare beneficiaries can change their Part D, their prescription drug coverage, And they can make that change without answering any health questions. It's an open enrollment. So it doesn't matter if they're just recently diagnosed with cancer or some other illness. Companies have to allow them to make the switch as long as it's done by December 7th. And this is a great time of year. And what I do with our clients at Paying for Alzheimer's, we use this as a way of telling them, let's review your Medicare coverage and see if it still meets your needs. Because a lot of people tend to think of Medicare as a one and done decision that they join in at age 65. But when in reality, there's a lot of opportunities to change aspects of your coverage to better meet your healthcare needs. So if you're diagnosed with a chronic illness, you're placed into a nursing home, there are opportunities to change your coverage to something that will better fit your healthcare needs. So clients have Medicare questions and are needing guidance. Everyone has grandparents, parents, friends who are Medicare beneficiaries and may need your help. My mother-in-law lived till she died about a year ago. She lived to be 100 years and 6 months old. And even to the end, she was strong cognitively. What frankly killed her was when she was dropped at the hospital and she broke her hip. And when you're 100 years old and 6 months, that's almost a death sentence. So her goal was to get out of the hospital, out of the rehab, and get home to where she could die surrounded by her friends and family. And she did. And within 3 days of getting home, Miriam passed away. But I had helped her for many years with her Medicare elections. And she always had questions. Of course, she had a friend named Yvonne, who I think she trusted more than she did me. If I told her something and Yvonne disagreed with it, she'd say, well, Yvonne told me you were wrong. But that's typical. Some of you are already on Medicare, as I am. So knowing how it works and what opportunities there are to make changes to your coverage can be very helpful to you. So it's never a one and done decision. And when we get into this annual enrollment period, I encourage all of my friends, clients to review their Medicare coverage and make changes if they're warranted. Let's look at some of the changes in 2025. The biggest one is that there'll now be a maximum out-of-pocket limit of $2,000. Keep in mind that that applies only to Part D and not to Part B drugs. I bring this up because a lot of people don't realize Part B, which covers doctor office visits, durable medical equipment, but it can also cover drugs that are infused either at the doctor's office or at an infusion center. So Part B does cover certain drugs. When we talk about a maximum out of pocket here, we're only talking about Part D, which are mostly drugs that you get at the either mail order or through the pharmacy that you swallow. But will be a big help that in 2025, it'll be $2,000, which I understand it is still a lot of money to some households, but it's much better than the old rules where there were no maximum out of pocket. So going back to that early example, where you're suddenly faced with a $750 monthly bill for a $15,000 cancer treatment, that's unaffordable for most people. You'll also have the opportunity to smooth your out-of-pocket limit if the beneficiary applies for it. And so they have to be aware this is possible. You take $2,000 maximum, you divide it by 12, that's about $167 per month. Right now, when people go into the early in the year with a Part D plan, there's a $500 annual deductible, and they're going to owe that in January and February, and that may not be affordable, or for a lot of people, it's not affordable. but with your ability to smooth the out-of-pocket limit, that may make it more affordable for you. But again, you have to remember to ask to do that. Why they require you to ask, I don't know. I think they're maybe hoping a lot of people won't think about doing it. But if you know that and you can bring it to your clients as an alternative, that's something we can help with when the application has to be filed. Let's talk briefly about Leqembi. That is a drug recently approved, I think on July 7th by the FDA, as I mentioned. In general, Medicare covers drugs that have been approved by the FDA. So their approval to cover it was just took a couple days and they approved coverage. Now, what a lot of people don't understand is Leqembi is an infused drug. In other words, you get hooked up to an IV and you go to an infusion center, and that's where you receive the drug. Because of that, as I mentioned, if you have an infused drug, it's covered by Part B, not by Part D. So all of that stuff that I talked about, out-of-pocket limits, smoothing, does not apply to Part B drugs. Other examples of Part B drugs are chemotherapy, radiation, are all handled by Part D. And why is that a matter? Well, Part B pays 80% of the approved Medicare cost. So let's assume that Leqembi is going to be expensive. It's going to be, say, $3,000 a month. Medicare will pay 80% of that, or $2,400. The balance of $3,000 minus $2,400 is $600, and that has to be paid by somebody, either out of pocket by the Medicare beneficiary or by the Medicare beneficiary's Medicare supplement plan will also cover that cost. And that's why you have to be very careful when you talk to your clients, your patients. If they are in a Medicare Advantage plan, and this often the Medicare Advantage plan will not pay that other 20% of a Part B drug. So you have to be very careful to review what the Medicare Advantage plan covers. And there may be a reason why, if they're going to take Leqembi, they should move to a Medicare supplement plan if possible. My brother-in-law has recently been diagnosed with mild cognitive impairment. Because his diagnosis is fairly early, he may be a candidate for Leqembi. And so my sister-in-law is working on that now. But if he is, he would pay 20% of the cost unless he's in a Medicare supplement plan. Now, unfortunately, he's in a Medicare Advantage plan that does not pay that other 20%. So I told him when I met with him, you can actually move to a Blue Cross Blue Shield Medicare supplement plan, and they will not ask you about pre-existing health conditions. So if we can get this started now, find out if you're a candidate for the drug and get through the protocols, then I would suggest you get moved to a Medicare supplement plan. So this is an extremely important issue that if you have any questions about it at all, feel free to call me or have your clients call me or their family so I can explain the distinction. So, and again, the coverage of that 20% may differ depending on the Medicare Advantage plan that the person is in. So that has to be looked at carefully. Unfortunately, I don't think a lot of Medicare Advantage plans pay that balance of the 20%. I have had clients who I met after they were in a Medicare Advantage plan and they go in for chemotherapy and they find out 20% of the cost will not be paid for by the Medicare Advantage plan. And don't get me wrong, I think Medicare Advantage plans have their place and they can be good, but this is one area a lot of people aren't familiar with, and they need to be if they're going to be taking a drug under Part B. And I mentioned this earlier, there is increasing support for family caregivers. That was initiated by the Recognize, Assist, Include, Support, and Engage, or the Raise Family Givers Act of 2017. They issued what I think are excellent reports in 2021 and 2022 about providing greater support for family caregivers, including a long list of things that they thought local and federal government can do to support family caregivers. So I think they're on the right track. And I'm excited about the changes because so many of the clients I work with and we work with at Paying for Alzheimer's are at home care. And even something as simple as training people to be good caregivers will finally be provided. I always thought caregiving is not something that some people, it comes to naturally to everybody. And having a good program at no cost to teach you how to take care of your family member will be extremely beneficial. They'll also create a support team for you with a family home caregiver that we talked about at the last session. And there is a infographic that I provided to Renee that you can ask for that in very simple terms describes what the difference is between Medicare and its support of family caregivers now versus what it will mean once the guide program is in place. So I think we're seeing a lot of changes that will be very beneficial, particularly to low-income families. We talked about this, where if you want more information about the guide program, as I mentioned, there's the infographic that was made available at the August 10th webinar I attended. And if you go to this site, the cms.gov priorities innovation, you can find out more information about the guide program and how it will, I think, eventually help all your clients who are homebound and getting home care. So what can Paying for Alzheimer's do for you? Well, between now and the end of the annual enrollment period, please feel free to give me a call if one of your clients has a question. I'm happy to help them make to review their current medications and what Part D plan may be better suited for them in 2024. Also talk about, and we covered this at the last session, Part D has low income subsidies that a lot of people are not familiar with. And those subsidies help somebody if they are in Part D pay for things like the annual deductible, co-payments, co-insurance, the premium, all depending on the level of income. But they've simplified it to the point where I think it's finally going to be a little more understandable. And really my goal is to make as many people aware of that and how you go about applying for it. Because I think it's a great program. We are not for profit. We focus on financial education and coaching. We sell no products. We make no referrals to financial planners or to product salespeople. You can reach me at that number, 630-776-3767, or Jim at payingforalzheimers.org. As I said, I'm more than happy to talk to your individual clients and their families. I'm available to do either webinars or seminars on these topics because I think they're so important. So feel free to contact me.
Thank you so much, Jim. What a great presentation. Lots of great information here. And as you were talking about the guide model, as you talked about the Pathways program, I've added those to our chat as well. So if everyone wants to take a look in there, I'm also going to be putting a couple more bits of information about Share Network too. And I have put Jim's email address and phone number. So please make sure you take a look at the chat for all of this important information. But I'd like to open it up for questions about Jim's presentation. So Jim, Stephanie Bailey actually has a question for you.
Okay.
I'll read the comment. Thank you for this information. Do you ever refer patients and families to SHIP, the Senior Health Insurance Program, as a source of free and unbiased information? I wasn't sure when you say make no referrals, do you just mean to companies? But I'm so glad to have this information. Thank you.
No, SHIP does play a role. And if we think it's necessary, we can refer people to SHIP. But we work on a kind of a national basis with Medicare. In fact, I just met over the weekend with a new client. They had met with SHIP, but I'm trying to decide how to say this. I think we do a better job with clients talking to them about their Medicare coverage in context of their whole financial situation. And because we do gather data on their finances, we explain some of the financial assistance programs available. I'm not sure SHIP by itself goes into that much detail about the beneficiary's finances. And that's what we do, I think, particularly well. So if someone's coming to us, we'll ask them financial questions about their income level, assets, and if we identify them as eligible for many of these plans, then we'll get them started and give them direction. The other thing we do that I don't think SHIP does, we provide a database of private foundations that will offer financial assistance to lower income families on paying their drug costs. And for example, the PAN Foundation has an excellent program that you can sign up for, and depending on the disease, they do it kind of in a silo method where if you have Alzheimer's disease or you have Parkinson's, you go to that particular part of the PAN Foundation that will provide financial assistance to meeting those costs of those drugs. Now, the downside is often during the year, PAN Foundation only has so much to contribute towards the beneficiaries. So they may run out of money, but they'll inform you when there's money has been replenished in their program and encourage you to apply. So I think SHIP does a good job. I just think we're a little broader in our approach. But yeah,
Great.
in general, I'm sorry.
No. Thank you. Thank you. We had a question about what was the name of the foundation? The PAN Foundation, PAN. Is that the correct one?
Yeah, I have it. It's a Patient Access Network, PAN.
Okay. Mm-hmm.
And they offer some excellent, they have a woman there that does a wonderful job at in her seminars on issues related to.
They actually are a very good foundation. I've worked with them. Being a social worker, I've worked with them before. They do a lot of work with chronic diseases as well. So they're somewhere good to look into. Looking for different support for monthly medications and treatments and things.
Yeah, and I don't want to neglect. I'm sorry.
Go ahead.
No, I don't want to neglect. Here we're talking about people who are in Medicare, either aged into it, age 65 or older, or in it because of disability. I do have clients. And for example, I have a client with myotonic dystrophy. It's a horrible disease. He's only 45. He's never been able to qualify for Medicare because of a spotty work record. But someone like the PAN Foundation would be available to help him because he can't get on Medicare. Right now, he is on Medicaid, but I think overall he'd be much better if we could get him on Medicare because of his disability. So the PAN Foundation can help people under age 65 as well.
Awesome. I put that in the chat. So Tessa, I actually responded to your message and I put the website in there, panfoundation.org. Another question came up. Do you offer, and I think you mentioned this in your presentation, that do you offer patients' families with a list of private foundations that can assist with private caregiving, long-term care placement costs as well?
Yes, there are some. I've been surprised. Let me give you a quick example. I don't know if you know the comedian Seth Rogen. I think he lost both parents Alzheimer's, and he has a foundation called Hilarity for Charity that he and his wife run.
Yes.
Now it has a fairly narrow focus is on helping home caregivers, give them a grant so that they can get respite care. And I know
I'm so glad you brought that one up. That's a great grant. Absolutely great grant. I'm going to post that one in there too.
Yeah, I know when my older brother was dying of Alzheimer's, one of the things I was concerned about was my sister-in-law, Leslie. She had been in public health and taught at the University of Kansas Medical School, but I was concerned about her health because this was during the pandemic, and my older brother just could not stand the thought of somebody coming into the house to take care of him. And he really put up a struggle. And my concern was getting her respite care so that she could get away, and even if it's just overnight. And that's what the PAN Foundation. You also could check the ACL.gov. They often have grants that you put in your zip code, and they have respite grants too.
Yeah, and the Hilarity for Charity grants, they actually do a really good job with being able to provide a certain amount of coverage over time. You know, you can also renew. I think they did finally cap when they first started. They didn't cap how many times you could actually receive the award, but I think they've capped it to like 2 or 3 times. And it can be for home caregiving, it could be for personal, like, you know, having family members that are caregivers. You can actually utilize it, like you said, for respite care. There are quite a few different options. There is a whole application to fill out on their website, but they do make it quite easy. And I believe there are, if I'm not mistaken, there used to be one. There's a home care agency that used to actually have a grant program too. I'll have to go back and take a look and see, but they did some work in being able to provide some of that education. So I put that website in the chat for everyone too. And then I'm going to get out your, go ahead, Dave.
If you've looked at the administration for community living, ACL, that I think also has great information on financial assistance geared to your community based on your zip code. But that's always something worth taking a look at.
Yes, and they have one that is for that gets a little bit thicker. I'll put the website in the Zoom as well for ACL for that are those that are not familiar. But we have one last question before we open it up. It is from Harriet Dart, and it says, do you work with low-income clients in the open marketplace before they're eligible for Medicare?
Typically, those people are already on Medicaid, but yes, we can work with them on their situation if they're on Medicaid also.
Okay. Awesome. Perfect. Okay. Everyone, thank you so much for all of your questions and your engagement. Jim, thank you again for this great presentation. And look at all the tools that we've been able to walk away, the PAN Foundation. Please, please, please take note of all of these. I'm going to copy all these and make sure I can send them all out to you with little descriptors for a few and try to add some more. Home Instead, that's the other one. Home Instead had a grant. I'll add that one into our list.
Can I mention one
But
more?
yeah, please
Okay.
do. Please
And
do.
I brought this
Res-
up at the last one. It's benefitscheckup.org, and
you
that is
got
from the
it.
National Council on Aging. And that to me is the best kept secret, and it shouldn't be, because when I am dealing with a low income family, in fact, any family, you can go in there, you can put in the zip code, some basic financial information, and benefitscheckup.org will create a long report on all the state, local programs that are available in your area. It's a wonderful tool
Mhm.
to use and a great place. And so it may show you that you're eligible, or your client is eligible for a subsidy to help pay their utilities or their food. So it's a great tool. So it's benefitscheckup.org.
Absolutely. And when you are looking for resources, I did put it in the chat. Don't mind me doing a plug, but the Share Network Healthy Aging Resource Guide. We have an electronic version, which I did post here in our chat. Please take a look into that information. Another tool is going to be the Alzheimer's Association. Their Alzheimer's Navigator tool is a fantastic resource to go through. If you haven't utilized that, I'll put that in our follow-up email by the end of the week. There's lots of good tools to be able to help to kind of narrow things down. But I'm just so glad that we're sharing all these different resources that are out there. If you have any others that you'd like to share that you're using, or if you have other programs that you want to share, you're more than welcome. The floor is open in these last few minutes here. And otherwise, if you think of ones during the week, send them on over. I'll compile a big list for our group, and I'll send all of that information out, because these are things that we need. These are things that we want to share with our community. And I'm loving everybody rallying behind all the great resources here.